Hey, everybody, I'm going to give everyone just a few minutes to get logged on and then we will get started. All right, we will let people continue to get logged on, but we're going to go ahead and get started for time's sake. Thank you all for coming. This is the Rare Across America training webinar. We're excited that you're all here and we're going to cover lots of information. So if you have any questions about Rare Across America, I hope that they get answered. So to get started, we do have closed captioning and language translation options. For closed captioning, all you have to do is hit the live transcript button at the bottom of your window. And to access the Spanish translation services, you just click the link that Rachel is going to post in the chat for you. So for the agenda, I'm just going to go over some quick introductions, give you guys an overview of Rare Across America and RDLA. And then we are going to hear from Lincoln from Advocacy Associates. He's going to give you more information on the online platform and your schedules. Then Bailey is going to cover the RDLA Legislative Ask. I'm going to give you guys some tips for successful meetings, show you some resources, give some information about the office hours, and then we will answer any questions that you have. So just to introduce everybody very quickly, my name is Caitlin. I'm the RDLA Program Manager. If you have any questions at any point about Rare Across America, please send me an email. You can copy my email down from the screen here. Again, we have Bailey. Bailey is our State Policy Manager. Then we have Sabrina. She is the founder, CEO, and director of the EWE Foundation. Sarita is going to introduce herself in a moment, but she has done Rare Across America many times now. So she is a nice expert here to give you guys some tips from the advocate perspective. And then last but not least, we have Lincoln from Advocacy Associates. So Sarita, I will turn it over to you and let you introduce yourself.
Thank you, Caitlin. So, hey, everybody, I am Sarita Edwards. I am the founder and CEO here at the EWE Foundation. I'm also a parent advocate. My husband and I, we have 5 children. Our youngest, Elijah, was diagnosed in utero with rare disease, Edwards syndrome, or trisomy 18. That really started our efforts of advocacy and public policy, and that journey for us started almost 5 years ago now. So what I like most about really participating with Rare Across America is it's an opportunity to really expand our voices and create this collective voice on behalf of the rare disease community. Could you go to the next slide for me, Caitlin? It's an opportunity to connect with others and hearing other people's stories, even if their disease affiliation is not the same as yours, is powerful. We have a lot of shared experiences and a lot of different things that we do the same or differently. So having that voice of another person is always impactful when you're on a rare disease journey. It's an opportunity to meet with your legislators. It's really great to know to some degree, the people who represent the community where you live. And so having that opportunity to build those relationships and those connections and have them know a little bit about you and your journey is huge. And so I really enjoy meeting the legislators and their staffers and really keeping those relationships beneficial and impactful even after Rare Across America is over. It's an opportunity to share your personal story. Not only do you have the chance to share your story with other advocates that you meet, you share those stories with your legislators. They ask you questions about your experiences. You're able to share a little bit about your journey. And I think it leaves an impressionable mark when you're able to do that from year to year. A lot of the staffers, they remember who you are based off something that you've shared. So it's really huge to be able to just share a little bit about your life living with rare disease or your life being the caregiver of someone living with a rare disease. And then you have opportunities like this, trainings and development opportunities that really expand past Rare Across America. You use a lot of the tips from these type webinars for your meetings, your Rare Across America meetings, but they also help you just across the board in your rare disease journey. A lot of the trainings and the development strategies that I have gained, I've been able to use in our nonprofit space. I've been able to use in just better critiquing our stories in that elevator pitch. So Rare Across America is really just an extensive opportunity to get a wealth of information, to meet some really great people, and to use your story to impact legislative policy. So thank you, Caitlin. I'll turn it back over to you.
Thank you, Sarita. All right, so I'm going to give you guys just a little bit more information about RDLA and Rare Across America. So just to break it down a little bit, RDLA stands for Rare Disease Legislative Advocates. We serve as a clearinghouse and advocacy center for the rare disease community. We provide resources and tools for individual advocates as well as patient organizations. And all events and resources that we offer are free and available to everyone in the rare disease community. We are a program of the EveryLife Foundation for Rare Diseases. If you want to learn more about everything that RDLA has to offer, you can go to rareadvocates.org. We have a lot of programs under RDLA. As you can see here, we host monthly legislative webinars, and during those we cover updates on state and federal legislation or state and federal issues that are impacting the rare disease community. We also work very closely with the Rare Disease Congressional Caucus, hosting 4 briefings with the caucus each year. Of course, Rare Disease Week on Capitol Hill is the biggest event that we offer. This event takes place at the end of February during Rare Disease Week, and we all go to the Capitol and meet with our members of Congress. We also have a lot of other activities going on, like legislative conference. We have a congressional caucus briefing. There's all kinds of things going on during Rare Disease Week, so definitely check that out. Of course, Rare Across America. A new program that we offer now is Rare Advocacy Learning. So this is a seminar style class. The topic changes or will change. We've just finished our first one, and it was on state issues. So we'll continue to grow on Rare Advocacy Learning. We also have YAR, which is our Young Adult Representatives of RDLA. So this is a really amazing group of young adults ages 16 to 30 who are very involved in the rare disease community. So if you are within that age range and not a member of YAR, I really encourage you to check that out. We also have our Rare Voice Awards, which we host at the end of every year, basically just celebrating the champions within the rare disease community. And last but not least, we have Rare Giving. So if you are joining us today and you are with another organization, another rare disease organization, and you're seeking funding for an event or a tool and resource that you guys are working on, I really encourage you to check out Rare Giving. That is where we offer sponsorships to other rare disease organizations. So what is Rare Across America? Rare Across America is the opportunity to meet with your members of Congress at their in-district offices. So each member of Congress has an office both in Washington, D.C., as well as an office or multiple offices in their respective districts and states. So during Rare Across America, we're meeting with members of Congress at those in-state and district offices rather than their D.C. offices. We do meetings with them in their DC offices during Rare Disease Week. So if you're interested in that, join us for Rare Disease Week. But Rare Across America is a great opportunity to educate your member of Congress on the issues that are most important to the community. So how does Rare Across America work? Meetings with members of Congress are scheduled for you based on your availability. Whenever you registered, you should have seen a box to indicate the days that you are not available, and we do our best to schedule around that. All Senate meetings this year are going to be virtual, so Typically, like I said, these meetings would be at the in-state and district offices. But for COVID safety reasons, Senate meetings, which tend to be larger, are all going to be virtual. There will not be any in-person Senate meetings. And all House meetings, which are smaller, are going to be in person. I put on here, no meetings are being held virtually with an asterisk, because that was our intention to not schedule any meetings virtually, but we have heard back from a few House meetings or a few House offices that are not doing in-person meetings yet due to COVID. So some House meetings will be scheduled virtually on just a case-by-case basis. So team coordinators are going to be assigned to meetings with 5 or more advocates. And these team coordinators are really just there to help organize the meetings, to help you guys prepare. Team coordinators are advocates who have done Rare Across America and Rare Disease Week in the past. So they're a really great resource as you begin to prepare. And we work with a third-party firm called Advocacy Associates. So they are the ones that are actually scheduling and requesting these meetings. And they will be the ones to send you your meeting schedule. Your meeting schedule is going to be emailed to you next week, the week of July 25th. It will likely be sent on Thursday or Friday, so closer to the end of the week. And during Rare Across America, you will receive emails from Advocacy Associates if your schedule has changed or anything like that. And you will also receive reminders about your meetings 48 hours prior and 1 hour prior to each meeting starting time. So our goals for Rare Across America are really to advance legislation that would benefit the rare disease community and to strengthen relationships with members of Congress. So a best practice of effective advocacy is making friends before you meet them. And we need to gain allies in both parties who will champion rare disease causes. So it's very important that we are meeting with all of the members of Congress, no matter their party or state or affiliation. We are really here to build strong alliances. And you may be thinking, why does this matter? Why is it important that we do these meetings? And as you can see on this chart here, this was made by the Congressional Management Foundation. They did a survey and asked members of Congress what influences their votes. And you can see that in-person visits from constituents have the highest amount of influence when members of Congress are voting on different pieces of legislation. Contact from constituents is also very high. So these in-person and virtual meetings are very important and do have an influence on your members of Congress as they're voting on legislation that will impact you. So I'm now going to play a video recorded from Lincoln. He is breaking down everything that you need to know about Rare Across America, about your schedule and those logistics. So I'm going to pull this video up for you guys. If you cannot hear it, Sarita, if you could just let me know and I'll see if I can figure it out. So we'll see.
Hello, my name is Lincoln Clapper, and I'm part of the Advocacy Associates team here in DC. I want to quickly review the Rare Across America schedules and logistics overview for this year's event and walk you through some of the features that you'll be using for both your in-person and virtual meetings this year in August. Now, just a quick background on the project format this year. So all of your Senate meetings are going to be arranged as virtual meetings. All of your House meetings will be arranged for in-person at the district office if you have opted into doing that. If the office declines an in-person meeting request, we will set that meeting up as virtual. But for now, this is the project structure that you can expect. These meetings will take place anywhere between August 8th and August 19th, 2022. Now, to get into your schedule, you will be getting an email from us sometime the week of July 25th. And this will be an automated email that will come from Advocacy Day at advocacyassociates.com. If you feel like you haven't gotten that email from us by the end of that week, check your spam or junk folder. It's probably sitting there. And if you do find it there, just unmark it as spam, as this will be our main way of communicating with you in terms of time changes, scheduling updates, cancellations, additions. All of that is going to come through over email. Now, to get into your schedule, you'll see a URL there along with some login credentials in the middle of that email. So when you click on that URL, it will take you to a login page where you will then need to enter those credentials. And that will look something like this. So once you tap on the URL, you're going to want to enter your email address and that temporary password that we provided to you in that initial email. Once you click the sign in button, you'll be prompted to change
Sorry, I don't know why it keeps doing that.
that password to your own password. So go ahead and set up your new password. Once you've met all the requirements, you'll see all the check marks turn green and you'll be good to go from there. Once you've set this password up and have logged in from a device, this will be the only time that you'll be asked to log in on that particular device. So if you're doing this on your phone or your laptop or your tablet, every time you revisit your schedule from that device, it will keep you logged in, very much like an app. Now, if you ever forget your password, you may become logged out, you may be trying to access from a new device, you can easily reset it. There's a forgot password link that will be on the home screen. Just follow the directions there. It's very much like any other online password reset process you've done before. If you have any technical issues getting into your schedule, there will be a contact link in that initial email from us. So go there for any questions, and our team will reach out to you to get all of those issues resolved. Now, for your in-person meetings, these screenshots for the next few slides will be taken from a phone, just to give you a sense of what that looks like going to your in-person meetings. All of your confirmed meetings will have a time next to them. That's how you'll know they're confirmed. Anything that's still pending on your schedule will show up as TBD. That just means we're still working on a time with that office. We may be having to reschedule something. Nevertheless, you will be updated with an automatic email once those meetings do become confirmed on your schedule. So you'll be very much in the loop moving forward for anything that's still pending when you do your schedule. All times on your schedule are going to be displayed in the time zone you're located in. So it will automatically adjust based on your location. We have taken your time zone into account when arranging all of your meetings. Now you will be able to distinctly see on your homepage the difference between your virtual meetings and your in-person meetings. Your virtual meetings will say in bold lettering virtual meeting, and your in-person meetings will have a physical address on them. And you can see that here in this example. The top meeting with Representative Greg Pence is a virtual meeting, and that bottom meeting with Senator Mike Braun is an in-person meeting. Now, to get more information about it, you're going to want to tap on any part of the module there. So if you tap anywhere within that red box, this will launch you into that specific meeting dashboard. So you'll see the time and date again at the top, who you will be speaking with in the office, whether it's actually going to be the member of Congress himself or their district staff or both. If there's been a meeting lead assigned to your meeting by the Every Life Foundation team, you will see that person's name displayed here. If not, then this area is going to be blank. Generally, this will occur for our larger Senate meetings, but you may see some of these for your House meetings. This is where you'll find the district office address and location. You can plug that into any navigation tool on your phone. There also will be a map there that will help guide you to the location if you'd like to use the map inside the scheduling portal. Now, if there's any content listed in the important information section, please make sure to read that. This may include anything and everything from maybe where to park, or who to call when you get to the office, or any type of COVID protocols possibly. Do you need to bring a vax card? Do you not need to bring a vax card? Each office will have their own specific instructions. Some may not have any at all. You may just need to show up to the office and you can walk right in and you're good to go. But nevertheless, if you do see anything in the important information section, please make sure to read that beforehand. Now, as you scroll down, you have to scroll down to get more content. You'll see a few other features. The first one will be the check-in feature. Basically, it's an attendance report. So make sure to check that button either before or after your meeting so we know that you made it, because we'll be sending this attendance report to the government affairs team after this event concludes. And so we want to be able to highlight that you made it to the meeting. You also have the ability to send a thank you email to the staffer who was present in your meeting. Once you tap on that button, it'll pull up an automated script for you to send, and it will also pull the staffer's email for who you met with. So it'll make it really easy to get that out the door post meeting. The meeting report form will pull up a specific list of questions for you to answer. Go through and answer those one by one once the meeting concludes while it's fresh on your mind. We'll be sending these results to the government affairs team as well, so please make sure to complete those. The take notes function is basically an opportunity for you to take freehand styled notes rather than using pen or paper. It's optional. You don't need to use it. It really just is an extra resource for you. Below that, you have the option to select if the member of Congress attended or if only staff attended. This is just a nice data point and every government affairs team likes to have after the event. So please mark one of those options as well. Sometimes the meeting may be scheduled with a member of Congress, but they get pulled away to a vote, so they're stuck at a committee hearing and they can't make it. Again, just a nice way to have that exact data point in debrief. And for you social media fans, you can access your Twitter, Facebook, or LinkedIn if you'd like to drop a post on any of those platforms. Your talking points module will display all of your talking points, and your documents module will display all of your documents. If you tap on the document, it'll open up in a separate tab for you. So you can start reading up on that now. You can have it up in front of you during the meeting to reference. All of it will be at your fingertips. As you continue to scroll down, you'll see an attendees section, and this will list all the attendees who will be in that meeting with you. If you only see your name listed here, that means you are the only attendee in that meeting. There may also be some relevant contact information displayed there for you to reach out to other attendees in your meeting beforehand. You can also contact each other through our peer-to-peer chat function. This is a direct messaging system that's specifically through the platform only, but you are able to message each other if you need to exchange information in the portal. The menu tab in the upper right-hand corner will pull up a navigation bar for you. This will allow you to tap on the meetings tab and go back to that home page so you can go to that next meeting on your schedule if you need to. There also is a few other additions here. There's a legislators tab, which will take you to bios for everybody you're meeting with, so you can read up on that beforehand. It also comes with a few other tabs, specifically a bills tab. So if you're tracking any particular bills for your event, that will be listed here along with that member's vote history on that bill. News will pull any relevant news information, news that they've mentioned in any articles recently, and you can read about those online. And the committees tab will show all the committees that they currently sit on. Some other options here in that navigation bar are the messages tab. That's where you can view those direct peer-to-peer messages between yourself and other attendees. The directory is a master directory of every attendee in the event, so you can contact people outside your meetings if you need to. And the support tab will be your best friend for anything and everything support, whether it's scheduling support, technical support, you can't make a meeting on your schedule anymore, which we absolutely need to know about. Please contact support. That's going to be the fastest, most efficient way to get any question resolved. Now for virtual meetings, again, you can take these on your laptop, your tablet, your desktop, and your mobile device if you need to. But the way to access that will be the exact same way you accessed it on your mobile device. So once you have your laptop or tablet or desktop in front of you, pull up that email that we sent you with your initial login credentials, and you click on that URL, and that'll launch you into your schedule at that point. If you haven't created your password, just follow the same process that I went through in the beginning and create your password to log in. Otherwise, if you've already completed it on your phone, you'll use that same password to log in on your laptop or tablet or desktop. And once you're logged into your schedule on your laptop, this is what that format will look like. It's very similar to the mobile version, just a little bit of a different layout. All of your confirmed meetings will still display with the time, and anything that's pending will still show up as TBD. You want to click on any part of the module there to get launched into that specific dashboard, and you'll have all the same features that I've already reviewed, again, just in a different layout. Specifically will be what's specifically different about this is the join online meeting button, and that's what you will press to join the virtual component for that meeting. If you need to dial in, we'll have dial-in instructions as well. But everything that you need to access the virtual meeting will be in this area here. If you have any issues, whether you're on a laptop or tablet, or any issues with your virtual meetings, you can go to the support tab in the middle of our navigation bar there and contact us. This really, again, will be the fastest, most efficient way to get any question resolved, whether it's has to do with the meeting or a time change, or you can't make it, or a technical issue. Please visit support. Okay, last slide here. So just some relevant information and reminders to keep handy for this specific event. Check your spam or junk folder to, again, ensure you haven't missed that email from us. The schedules are going to be going out sometime the week of July 25th, so just keep an eye out for that. For virtual meetings, we're asking you to get in, whether you're calling in or via video, 10 minutes prior to the start time, just to make sure you get any technical glitches out of the way. You can touch base with the other attendees in your group. That way, when the meeting starts, that way the meeting can start right on time. For in-person meetings, we're asking you to get there roughly 10 minutes prior to the start time, just to ensure in case you encounter any traffic or maybe you have trouble finding the office location. Again, we want to make sure you get there early. That way the meeting can start right on time. All times on your schedules are going to be displayed in the time zone you're located in when viewing it. So you will not need to do any time conversions. It will adjust automatically to your location. You're going to get reminder emails 1 hour prior to each meeting throughout the course of this event. This will include a link to your schedule in it. And it'll also, it'll just help you get in and out of the portal throughout the course of the event. For virtual meetings, if the office doesn't join within 10 minutes, please let us know. There will be a help number in the support tab to call if there is a time-sensitive issue like that. But please do give the office 10 minutes buffer time to join before letting us know. These meetings are going to go anywhere from 15 to 30 minutes, so just have your talking points prepared accordingly. And any changes to your schedule are going to come through over email. So again, make sure you're keeping an eye on that pretty regularly over those couple of weeks, as we'll be in touch with any updates. And that concludes this presentation for this year's Rare Across America event. Thank you very much.
All right, so that is the overview on Advocacy Associates. So I'm now going to turn things over to Bailey to cover the asks.
Hey everyone, my name is Bailey McGowan. I'm our state policy manager. It's great to see everyone, kind of. We can go ahead to the next slide, Caitlin. So what is an ask? That's just our way of saying the legislative asks. So this is what you guys are going to be, talking to your representatives and senators about. So I guess I'll just dive right in. The first ask that RDLA is putting forth is our joining the Rare Disease Congressional Caucus. As you guys are well aware, there's over 7,000 rare disorders that affect about 30 million Americans and their families. Rare orphan diseases are defined as affecting fewer than 200,000 people in the United States, and many rare diseases are considered ultra rare, so some have less than even 100 people. And a lot of them can be life-threatening or have no treatment options. So it's really important that we get our officials and our legislators involved in this process. So bringing the public and congressional awareness to the unique needs of the rare disease community, including, everyone needs to be at this table. So we're talking patients, physicians, scientists, and industry. And this can help really create new opportunities that address some of the barriers to development and access and can really alter lives. So with this one, we're just asking them to join the Rare Disease Congressional Caucus. The next one is Newborn Screening Saves Lives Reauthorization Act. So again, 1 in 300 babies is born in the United States are detected to have a potentially devastating condition through newborn screening. So this again helps save lives. Newborn screening programs are really dependent upon the state, and this can really lead to just different health outcomes in each state. So some states screen for 30 conditions, other ones screen for 60. It's a little all over the place, but there is a federal newborn screening program. Well, it expired September 30th, 2019. So EveryLife Foundation has been working really hard to try and get this reauthorized. So if we can reauthorize this bill, the Health Resources and Services Administration state grants to expand and improve screening program, provide educational resources to parents and healthcare providers, and can improve follow-up care for infants detected through with a detected condition. So just asking them to co-sponsor this to, again, help save lives and, detect more rare diseases at birth when we can be really impactful and influential in the process. This next one is the Help Ensure Lower Patient, or the Help Copays Act. So people living with serious chronic conditions often have to face a lot of different barriers to accessing their therapies. If they have a therapy, and so when you have one, you're trying to get these conditions, administrative hurdles like prior authorization and step therapy really limit access and timely access to these specialty medications. And patients are facing skyrocketing deductibles, really steep cost sharing, and with no other options to afford their medication, many patients turn to charitable or manufacturer copay assistance to afford their drugs. The solution to this is the Bipartisan Help Copays Act, which would eliminate barriers to treatment for patients, ensuring that they can afford necessary and life-saving medication prescribed by their providers. So the legislation requires that health plans count the value of copay assistance towards the cost sharing requirement for a patient. So this would, bring a lot of financial relief to vulnerable patients by ensuring that every payment made in their name by them out of pocket or from another program would count towards their out-of-pocket costs and deductible. So we're just asking them to co-sponsor the Help Copays Act. Right, then we have the Access to Genetic Counselor Services Act. Current Medicare policy denies direct access to highly trained board-certified genetic counselors to navigate the complex factors of a genetic rare disease that could be affecting their health. And so limiting this access can really result in increased wait times for genetic testing and subsequent delays in diagnosis. The less access we have, the more time it takes. So the solution to this is the Access to Genetic Counselor Services Act, which would provide Medicare beneficiaries with direct access to genetic counselors, enabling genetic counselors to bill Medicare directly, enhancing the team-based care for patients, and addressing health disparities for those with lower incomes. So again, the ask is just co-sponsor the Genetic Counselor Services Act. And the last one is the Prescription Drug User Fee Act, or PDUFA. So the problem and background for this is PDUFA was passed by Congress in 1992 in an effort to support regulatory review infrastructure within the FDA. It facilitated the creation of resources by allowing the FDA to collect fees from drug manufacturers for the drug approval processes. The purpose of the PDUFA was to improve the length of time of product approvals at the FDA. Since PDUFA was enacted, user fees have played an important part in expedition of drug and medical product approval review process. It has to be passed every 5 years, and so it's set to expire in September of this year, which is not far away. So the solution is to, renew and pass PDUFA, which would formalize the inclusion of patient experience data into the drug development and review process, making patient engagement a huge part of this process and really making sure that it's serving the people that it's meant to help. The use of real-world evidence for regulatory decision-making, again, what we want to see is them engaging with patients and using this data and not just arbitrary standards, and the dedicated process to improve the use of biomarkers as surrogate endpoints in drug development. So the way we do this is asking them to vote to pass PDUFA. And I think that's all of our asks. All right. Happy to answer any questions.
Thank you, Bailey. If anybody has any questions about the ask, please go ahead and place those in the Q&A box. And when Bailey sees them pop up, she will respond to your questions in the box there. So we are going to move on. One question that we always get is, what should I expect during my meetings? I like to think of the meetings as being broken down really into 4 sections. So the introductions, the stories, the ask, and then of course, thank you. So in your meetings, each advocate should have the opportunity to introduce themselves at the beginning of the meeting. If you are in a Senate meeting, from a state like California, New York, or Florida, where we have a lot of advocates participating, it may be best to even introduce yourselves in the chat box. If your meeting is going to be on Zoom, which will be indicated on your schedule. But regardless, each advocate should have the opportunity to introduce themselves. So this is just a quick introduction, like, hello, my name is Caitlin and I'm from Boone, North Carolina. So this will just, again, tell the member your name and where you are from in their district. Next, we have the stories. So a minimum of 2 advocates per meeting should share their rare disease story. And you should think of your rare disease story during these meetings as an elevator pitch, so 60 to 90 seconds. I mean, it's very important that the members and their staff hear these stories because they will inform their decisions on legislation that impacts the rare disease community. Next, we have the asks. So the ask is what you are trying to get your member of Congress to do. The number of advocates that make an ask is going to depend on the size of your meeting. So if you have less advocates in your meeting, then it may be that everyone gets to make an ask. But again, going back to the large Senate meetings like California, there's just not enough time for everybody to make an ask. So this is something that you will work out with your group amongst yourselves as you guys coordinate before your meeting day. And last but certainly not least, be sure to thank the member or the staffer for meeting with you. And if you haven't already, this is a great time to ask for a photo. And if there's extra time at the end of the meeting and you've given the member or the staff time to speak and share, then this is a great time for other people who didn't have a chance to speak before to speak now for a few minutes. So I'm going to break down the different sections of the meetings, and we're going to talk a little bit about stories. So the goal of sharing your story with your member of Congress is to make them aware of the challenges that the rare disease community face. So like I said before, a minimum of 2 people should be able to share their story per meeting. If you're in a smaller meeting with 5 to 10 advocates, then more people should be able to share because you guys will have more time. And each advocate that shares their story should share for no longer than 60 to 90 seconds. So think of this as an elevator pitch. And if you're interested in learning more about sharing your story, you can go to the Rare Cross America website and view the Share Your Story with Policymakers webinar that we just held last week. And your ask, again, the goal is to get your member of Congress to take action on your priority. So when you are making your ask, be specific. So for example, if your ask is the Rare Disease Congressional Caucus, then you should say, I'm asking you to please become a member of the Rare Disease Congressional Caucus. Each advocate should make no more than 1 ask per meeting, and each ask should be no more than 60 seconds long. And the reason that we say this is because time is limited in these meetings. You all will have anywhere between 15 and 30 minutes for your meetings, and that will be indicated on your schedule. So we just want to be sure we're giving everyone time to speak. When you're choosing your ask, it's important to choose what piece of legislation is most important to you and connect that to your story. And Bailey just covered the RDLA suggested ask, but if you're not interested in any of those asks, that is okay. You can make your own ask. When you are selecting your ask, though, it is important to be sure that the member has not already done the action that you are asking them to do. So if your member is already on the Rare Disease Congressional Caucus, you should not make this your ask, but you can thank them for joining. And just to go back to choosing your ask very quickly, if you do choose an ask that isn't one of the RDLA suggested asks, then we do ask you to create a 1-pager on the legislation or issue that you're asking the member to support. And on the Rare Cross America website, you will find a tip sheet on how to create your 1-pager. But really, just keep it brief and present the information clear and concise in bullet points. Be sure to include a brief statement explaining your organization or your disease. I'm sorry, I cannot stop yawning. And then be sure to give a brief summary on what the legislation is and what it will do. Be sure to include what your member of Congress can do to help and include your ask. So again, if you're not making one of the RDLA suggested asks, or I'm sorry, if you are making one of the suggested asks, you can find the one pagers for those asks on the Rare Cross America website. To speak a little more on the website, we have tons of resources for you there. So if you go to the Rare Cross America website, this is the screen that you are going to see. So we've broken it down into preparing for and executing your meeting and following up after your meeting. So when you click on the prepare for and execute your meeting tab, these are the resources that you are going to see. You are going to see one pagers for the legislative ask. There's going to be a tab on meeting structure and sample agenda. So if you say don't have a team coordinator, there's only 4 people in your meeting, but you still want to create an agenda and you're just not sure how to get started, this is a great place to go. We've really broken down what the agenda should look like and what the meeting structure should be. So I encourage you to check that out. We've also included useful links. This includes links to the tip sheet on how to create your own one pager. It also links to the congressional scorecards. So if you have not had a chance to check the scorecards out, definitely go here and check those out. You will also find the training webinar recording. So this recording will be there. And then the recording from the Share Your Story with Policymakers webinar will also be there. We also have a frequently asked questions document. And I tried to brainstorm every question possible that anyone could have for Rare Cross America and put the question and answer there. So if you have a question, check that out. And of course, if your question's not on there, didn't answer your question, you can send me an email. We also have information on how to ask for a photo during your meeting, as well as information on how to share your experience on social media. So if you've participated in Rare Cross America or Rare Disease Week with us in the past, then you will remember the printable signs that we create for you to take photos with during your meetings. This is where you will find those. You can also go here to find COVID-19 safety information and the Rare Cross America Code of Conduct. And if you still can't find what you're looking for, please email me. My email is here on the screen, or it's klaws, L-A-W-S, at everylifefoundation.org. So what should you do before your meeting? The most important things that you can do are learn about your member. So check out their website, check out the press releases and newsletters on their website. Also take a look at their social media account. So this will just give you a good idea about what their priorities are and where they stand on issues that you may be going to speak to them about. I also encourage you to learn about your ask. So really learn about the bills that you want to discuss and make sure that you know the bill number of your ask. So every House bill or Senate bill is accompanied by a number. So for example, the Help Copays Act is HR 5801. So when you go into your meeting, you're going to want to say, I'm asking you to co-sponsor the Help Copays Act, which is HR 5801. So make sure that you know that bill number. That will be important. And again, make sure that the member has not already done the item that you're asking them to do. I would say the most important thing on this slide is the next point, coordinating. It's really essential that you coordinate with your team before the meeting and determine who will make the ask, who will tell their stories. You don't want to go into a meeting, no matter how many people are in the meeting with you, and not really know what the other person's there to talk about, or maybe not know the order. So absolutely coordinate this beforehand. As mentioned before, meetings with 5 or more advocates will have a team coordinator, but we absolutely still encourage the meetings with less than 5 advocates to coordinate with each other. So you will be able to get each other's email addresses from the Advocacy Associates platform. And I also encourage you to practice. So be sure to practice both your story and your ask. And again, pick the talking points that are most relevant to you and to the member. What to do during the meeting. It's important to show up, no matter if it's in person or virtual. It's absolutely essential to show up to your meetings. If possible, arrive early, and this is for both in person and virtual. And if you see that you're no longer able to attend, please email me. This is very important. Like Lincoln said, whenever they schedule meetings, they are telling the office how many people to expect. So if they are expecting a group of 30 advocates and 5 show up, that doesn't reflect well on the rare disease community or on RDLA. So please let us know if you are not able to attend your meetings. It's also important to smile, be respectful of the member and their staff, and to say thank you, thanking them for any actions they've taken in the past to support the rare disease community, and just thanking them for meeting with you. These offices are very important, so we absolutely appreciate the time that they are giving us to come in and talk about our priorities. And to touch on that a bit, be sure to avoid talking politics. So I'm sure you've all heard this 100 times before, but rare diseases are nonpartisan and we need champions in both parties. So be sure to avoid talking politics in these meetings. We want to stay on topic. So what should you share? If you are advocating on behalf of someone else and they are not there with you, having a photo of them is very powerful. The member is able to see and put a face with the story that you are telling. If you are participating with another organization and you have their brochure or a brochure on your disease, this is a great thing to share as well. Your contact information is very important to share. And I'm going to talk a little bit about that some more in a second. And then the one pager on your ask. So again, the one pager either that you created, if it's not one of the RDLA ask or one of the one pagers that are already on the website, either way are important to share. So tips for your virtual Senate meetings. We want to look and sound our best on Zoom. So be sure that the lighting is good. You want to make sure you're not sitting in front of any super harsh light because then you'll just show up as a shadow. Make sure there's not, a big mess behind you. A blank wall is totally fine. And make sure that everyone can hear you and that your audio is working. And you may get some tough questions in these meetings. So if the staff or the member asks you a question and you just don't know the answer, that is okay. There's no way that all of us can know everything. So you can just say, I'm not sure, but I'll find the answer to that question and get back to you. Can I please get your email so that I can follow up with you? And this is also a great way to initiate your follow-up. So if you don't know the answer to a question, that's fine. Get their email and follow up with them later. And if you need help answering that question, let us know. Reach out to us and we'll help you out with a response. And if your member's not supportive of your ask, just be respectful and tell them, I'm sorry that we don't feel the same way, but I hope there's something we can work together on in the future. And after your meetings, it's very important to follow up with the staffer that you met with. And I'll add here that we do request meetings with the members, but as you know, members are busy and oftentimes their staff will be the ones to meet with you. Don't be discouraged by this. The staff are extremely knowledgeable. They are fantastic resources. So meetings with staff are no less important than meetings with the members. So following up with the staffer that you meet with is very important. During this follow-up, be sure to include your contact information, the one pager for your ask, and then again, your ask. Be sure to re-emphasize the key points that you mentioned during your meeting. We've created a template follow-up email, and you can find that on the Advocacy Associates platform or on the Rare Cross America website. We also love to see your social media posts, so be sure to post about how your meetings went on social media and use the hashtag Rare Cross America 2022. And fill us in. We want to hear how your meetings went. So like Lincoln said, the meeting report is on the Advocacy Associates platform. So be sure to fill that out after each one of your meetings. And continue to follow your member after the meetings. Sign up for their newsletters, follow them on social media, attend their local events like town halls or fundraisers. And if there are any relevant action alerts, like if you see that the bill that was your ask is coming up for a vote, call the member's office and, reemphasize your ask. Tell them again how important this is. And if you see that they do complete your ask and they join the caucus or co-sponsor or vote for a bill, be sure to follow up with them and thank them for doing that. That thank you does go a long way. So we have also created some resources for after your meetings, like I mentioned. If you click the follow up after your meetings tab, you will see a link to the meeting report on the Advocacy Associates platform. So this is where you will find all the instructions that you need to complete that report. You will also find a sample thank you letter, which you can see here. You can go in and fill in all of your own information and use this exact template if you like. And then we also have some resources for sharing about your meetings on social media. Again, we want to know how your meetings went, so please fill out the survey. Again, post on social media using the hashtag Rare Across America 2022. And if you do take any photos in your meetings, please email those to me as well. If you write a blog about your experience, we would love to see that. So please share that with us. And be sure to tag us in your social media posts about your meetings. You can find our handles and our account information at the bottom of the screen here. And again, thanking the member for meeting with you is very important. So you could post a photo that you took during your meeting on social media using the hashtag, and you can use the printable sign here, which you can find again on the Rare Across America website. We are going to be hosting some more webinars. So our team coordinator webinar is July 21st. So this Thursday at 3:30. A link to attend has been sent to all confirmed team coordinators. If you received an email asking you to be a team coordinator and you have not responded yet, please get back to me. We really want to try to get all of the team coordinators confirmed before the webinar so that everyone is able to attend. And we did host the Share Your Story with Policymakers webinar last week. So that recording is available on the website to view. And we're also going to be offering some open office hours. So this is just a chance for you to come into a Zoom meeting and ask RDLA staff any questions about your meetings, the legislative ask, your schedule, absolutely anything related to Rare Across America. So the office hour that's taken place before Rare Across America is going to be on July 27th from 3:30 to 4:30. And then we will have a special office hour for our team coordinators. So if you are a team coordinator and you have any questions, come join us on August 4th, again, from 3:30 to 4:30. And then our last office hour is going to be during Rare Across America. So this is going to be on August 11th from 3:30 to 4:30. So if you start your meetings and you come up with a whole list of questions, again, that's totally fine. Join us for that last office hour and we'll get your questions answered. Some important reminders here are, most importantly, if your availability changes or if you're not able to attend your scheduled meetings, please let us know. We understand that life happens, things come up, so just shoot me an email. Again, it's klaws@everylifefoundation.org. If you are the only participant in the meeting, we will reschedule it for you. But if you are attending with a group, then we will let the office know to expect one less person. Again, I just want to reiterate that no shows reflect poorly both on RDLA and the rare disease community. So showing up for your meeting is really the most important thing here that you could do. And before we go into questions, I want to give Sarita a chance to just share any tips or tricks that she has with you. Share her advice as an advocate who has done Rare Across America and Rare Disease Week many times. So Sarita, if you have any tips or tricks that you want to share, I know everybody would love to hear them.
Thank you, Caitlin. So the first thing that really sticks out to me is really honing in on your story. We are all very passionate about our stories and our journey. And I would say, think about something that's really important, something that really stands out to you, something that will really be an impressionable thought left with your legislators, your members of Congress, or their staffers, and let that be what you share. We don't have the time to share all of our story. A lot of us have been in the space for years, so just highlight something that will impact them in that conversation, something that'll make them remember what you've stated. So that's one thing for sure. Really try to get it in that 60, 90 seconds. And then too, something that Caitlin already touched on, don't be discouraged if your member of Congress is not present. We've had some really great meetings with their staffers, and it feels good to come into the meeting with the staffer and they remember you. So when the member is present, they can say, oh, this is the one that I was telling you about, or this is the one whose kid is this. So take advantage to build those relationships with the staffers, because they can go back and tell the members a lot of things about you when they share what you stated during those meeting times. So those are my really biggest two key points that I love to just share with other advocates. Take advantage of meeting those staffers and really try to pull your story together in those 60, 90 seconds, just to make sure everybody has a chance, but to also make sure you're leaving the member with something so impactful, they'll remember what you've stated, and they'll remember the rare disease community just as a collective whole. So I think that's my two key takeaways, Caitlin.
Awesome. Those are both really important, really impactful takeaways. So I really appreciate that. I see a few questions here in the Q&A that Rachel and Sarita and Bailey have already answered, but I just want to answer them out loud for everyone because these are questions that I'm sure everyone has. So one question is, how long do the meetings typically last? So the meetings are going to be anywhere between 15 and 30 minutes, and this will be listed on your schedule. One thing that I do encourage you to do when you first get to your meeting is ask, how long do you have for this meeting today? They may have scheduled you for 15 minutes, but the person that's coming after you canceled. So they may have extra time now. So be sure and ask how much time they have, because that could grant you a little extra time. Another question is, if there are fewer advocates, can our story and our ask be longer than 60 to 90 seconds? So like I said before, the amount of people who tell their story or ask is really going to depend on the size of these meetings. So if you get to the meeting and there's only 2 of you, don't feel like you have to rush through your story or your ask, but also be sure that you're being concise. We don't want to be long-winded or maybe spend the whole 30 minutes telling your story. Well, I am so sure that what you're telling them is incredibly important. We want to be cognizant of their time as well. So that's really up to you all to decide. If you go in and you're the only person there, don't feel like you have to take the whole 30 minutes. Don't feel like you have to make it last the whole 30 minutes if it's just you or one other person. But if you both do want to tell your story and your ask and say you talk for 2 minutes rather than 3 or something like that, that's totally fine. So another question that I see is, how will we meet up with other advocates in our area? So like we mentioned before, when you pull up the Advocacy Associates platform, you're going to see all of your meetings listed. So to see the advocates in your meetings for each one, you're just going to click on each individual meeting and scroll to the bottom of your screen. And on the right-hand side, you will see everyone's name and email address who is going to be in your meeting. Go ahead and connect with them, reach out. Again, if it's a large meeting, you will have a team coordinator, and that will be indicated on your schedule. So if you have a team coordinator, they will likely initiate, or they not likely, they will initiate the outreach to you all. So they will initiate that. But if you do not have a team coordinator, absolutely connect with your group, reach out. And if you are doing an in-person house meeting, you all can coordinate meeting up together beforehand. Let's see if there's any other.
Okay, there's one I actually think is really important.
Okay.
Someone asked what to do if there was like a lame duck representative or someone who was on their way out. I think it's still really important to like put your all into that conversation. At minimum, you get more comfortable giving your pitch and asking for something and, you know, having these conversations with legislators, but you also never know who that person's going to talk to. And you never know that they could be so moved by your conversation that they, you know, share it with someone else who they're on a committee with, or their staffers might hear the conversation and they might wind up working for someone else. So what you share with these people really does have impact beyond just this immediate meeting. So I know it might be a little discouraging, like in the, you know, upfront thought, but it really does make a difference.
Absolutely. That's important. Thank you, Bailey. One other question that I just saw come in is, does the team coordinator determine who will share their story during the group meeting? So basically your team coordinator, if you have one, is going to reach out and introduce themselves and ask, you know, who wants to share their story, who wants to make an ask, and then they'll get everyone's responses and send an agenda back to you. So if you email them and say, you know, I really want to share my story, I have this prepared, or I really want to share my ask, either way, they will put you on the agenda. So if you really want to speak in your meetings and your team coordinator reaches out to you, please be sure to get back to them. Because if you don't respond, they have no way of knowing that you wanted to speak. So please respond to your team coordinators and they will craft the agenda for your meeting based on the responses that they receive. One thing I also want to touch on is the ask. So when you're in your meetings, don't feel like you have to make all of the suggested asks. So I know if, that this has been a little confusing in the past for advocates. So if you go into a meeting, no matter how many people are there, and say somebody wants to make the Help Co-Pays Act their ask and somebody else wants to make the caucus their ask, and you already have those two, don't feel like you have to make the other two asks just for the sake of making them. Really make the ask that is important to you and connects with you. And another question I just saw is, how personal should we be? You know, sometimes people may get uncomfortable when you're telling your story and talking about pain and sickness. So are we trying to avoid that discomfort, or should we talk about it? So Sarita, I actually am going to refer to you on this question because I know you have tons of experience sharing your story with members.
Thanks, Caitlin. You know, so I would say speak to what you're most comfortable speaking to, what you're most comfortable sharing. I wouldn't really go in trying to avoid discomfort, because that could be the piece of the story that needs to be heard. I think it's really all about what you're most comfortable sharing and what you can share, but keep your emotions together. You know, a lot of times when we talk about sickness and discomfort, like you said, it stir up all of those memories and emotions within ourselves. So I think whatever you can share comfortably, passionately, but minus a lot of emotion, I think go for it. I think it's all up to you and what you're most comfortable doing, for sure.
Definitely. I second that, Sarita. Thank you. But we are a few minutes over, so I'm going to go to the next slide. But if you didn't get to ask your question, or if you think of any questions later, feel free to email me and we'll work it out with you. So I just want to quickly give a thank you to our 2022 Rare Across America sponsors. We could not do this event without them, so we are very thankful to all of our sponsors. And again, if you have any questions, please reach out to me or to Shannon. Our emails are here on the screen. We want to be sure that everyone feels comfortable going into their meetings. We want you all to feel prepared. So, if you listen to this webinar and you search through the FAQ and you search through the resources and you still have lingering questions, please reach out. There are no dumb questions. It's okay. So feel free and feel comfortable to reach out to us. And also please use the office hours as a resource for questions as well. A lot of advocates will come in and just sit the whole hour just to hear other people's questions because somebody else may have a question that you didn't think of, but it's still a really good question. So definitely utilize the office hours for that. And we will see you all then. So thank you all for joining us. And thank you, Sarita and Bailey, for coming and joining us for today's webinar. Thank you, everyone.